Afternoon, everyone. Welcome to the session. Today we have Dr. Fiona Sim from the Graduate School at the College of Medical, Veterinary and Life Sciences. She'll be talking about the Infant Mental Health MSc program, which is part of our online distance learning portfolio. So thank you for joining us, Fiona, and I'll hand it over to you.
Lovely. Thank you, Anil, for having me. It's good to be here. So my name is Fiona Sim. I am the programme lead for the Infant Mental Health MSc programme. And I'll just share with you a little bit today about that programme and what you could expect coming to study this Masters with us. So this is the first Infant Mental Health MSc programme in the UK. The teaching explores the journey of the infant from pre-birth to preschool and the foundational threads of the centrality of relationships, significance of environmental influences, and competence of the infant will run throughout the programme. We provide a solid grounding in theory and equip students with contemporary insights into the observation and practice of supporting infant mental health and development. The programme aims to produce graduates who will contribute to the mental health and well-being of infants in their own unique context. And it's developed in collaboration with the National Health Service, the Scottish Government, and the Association of Infant Mental Health UK. We've also collaborated extensively with colleagues across the world, from the United States to South Africa to Ecuador, and we have teaching contributions from all over to try and ensure as representative case for the support of infant mental health globally as possible, and to aim to support you in whatever context you are joining us from. The teaching team comprises of internationally renowned clinical and research experts in the field. The Master's programme has been endorsed by the Association for Infant Mental Health UK, and they provided us with this lovely supporting statement, and they've added us to their online register of training providers. Now, this whole Master's programme has aligned all of our learning outcomes with the core competencies of the AIM UK Clinical Competencies Framework. And this enables our students to graduate from the Masters with a transferable portfolio of clinical competencies. This is an online distance learning and teaching programme, and it uses a blend of synchronous and asynchronous approaches. All of the teaching content and learning activities will be asynchronous, which means you can access them at any time to maximise flexibility of study for you. Students can access the courses and all the course content flexibly. And we have optional synchronous tutorials. So you can join in with these and we'll all be online at the same time, where you can ask me any questions, or whoever the course lead is, about the assignment. So we try and organise these synchronous sessions in alignment with the assignment hand-ins, which will happen usually twice throughout the duration of your course. So the programme, as you can see here, has multiple exit points. You can study the PG Cert in year 1, and you can finish your studies with the postgrad certificate in infant mental health, or you can continue on for a second year, and that will give you a postgrad diploma in infant mental health, or you can stay on for the third year, which will give you the full MSc in infant mental health. As you can see, we have tried to separate out these 3 years in terms of the theoretical foundations covered in year 1. So at that point, we look at the foundations of infant mental health and development. We look at infant mental health and neurodevelopment in practice. And we look at all of the systems that surround the infant. So we think about healthcare and education, we think about the legal system and how those influence the development of the infant and support the mental health of the infant and their family. In year 2, we focus in on skills building. So we want to develop the skills in you in infant observation, in reflective practice. And if you are interested in taking a research track throughout this programme, then at this point you can choose either to study research methods, or if you want to take a clinical track through this programme, you can choose to study clinical skills in infant mental health. Now, your option for these two courses will follow through into year 3. In year 3, you have the option of choosing either a research dissertation or an internship, a placement in a industry or work placement that supports infant mental health. Now, depending on which one of these you choose, you need to choose the research methods programme if you're going to do a research dissertation, and you need to do the clinical skills programme if you're going to do a clinical placement. But you don't need to make that choice until you're in year 2 and you've learned a bit about the options for further study in year 3. And then in the third semester of year 2, you're going to study an intervention of your choice. Now, we have a selection of interventions that can be tailored to your specific context. You can learn to provide circle of security, video interaction guidance, the neonatal behavioural observation, Mellow Babies, Watch, Wait, Wonder. We have a whole selection that can be used in primary care or clinical or education settings. And then in year 3, we look to apply your learning with the infant mental health internship or the infant mental health research dissertation that I've mentioned earlier. Now, when you are studying this master's programme, you will get access to a platform called Moodle, and Moodle will be an online platform. And you can go into Moodle and you'll have a tile for each of your courses. And you go and select which course you're on. And then each week you can click in. It's a very simple and accessible platform. You just click the learning content for that week and you'll get access to really high quality teaching materials. There will be short video clips from experts in the field. There will be some written content. There will be some interactive quizzes that you can engage with to consolidate your learning. And each week we try to build in a sense of community with the other learners on the programme. And so we have a class teams page for every course. And throughout your learning content, you will be asked note-taking activities, which are questions based on the learning content. You can then type in your response in the Teams page, and all of your classmates will get to see your response and post their responses too. And that will hopefully enable you to engage in real rich peer learning. And as the teaching team, we'll also feed into that class discussion. And I find it such a useful platform to learn from you and for each of us to really learn from each other and support each other through the learning journey. The entry requirements for this programme are a 2-1 honours or whatever the non-UK equivalent would be for that in psychology, nursing, medicine, education, social work, midwifery. We have quite a broad range of courses that would be recognised as appropriate precursors to studying this master's programme. We may sometimes also accept degrees at ordinary or non-UK equivalent. We may also accept applicants with significant relevant work experience in addition to lower qualifications. Essentially, as a programme lead, I'm really keen to have as diverse a cohort as possible. And I want the learning from this programme to equip as broad an audience as possible. And so if that means that you have been working in your field for a number of years, but just at that point you didn't require an honours degree to get into your job, we're not going to hold that against you, because the skills and experience that you have learned throughout your work experience is as valuable to us as programme leads as an honours degree is. And so we will take each application at face value and consider whether you have the relevant experience, even if you don't have the relevant qualifications. So please don't let entry requirements be a barrier to your application on this programme. The course is designed to equip learners with skills to progress within the following roles and industries: psychology, psychiatry, infant mental health, medical professional, social worker, midwife, health visitor, paediatrician, third sector, early years education. And we have a very broad cohort studying at the moment. We have infant mental health practitioners, educators, performing artists. We've got a really broad spectrum, and that's what we're really keen to do, because the learning that we provide you with, we believe, is fundamental to supporting infants and young families in the earliest years. And that can be done throughout a whole range of contexts. Completion of the programme grants potential for further academic study, promotion, increased earning potential, or changes in your career path. If you have any questions about this programme, please don't hesitate to email the programme mailbox at mvls.infantmentalhealth@glasgow.ac.uk, or contact myself directly, that's Fiona Sim, and my co-programme lead is another Fiona, just to confuse you, that's Fiona Turner. So you can email either of us or the course mailbox and we'll get back to you with our reply. Thank you for your time.
Thank you so much, Fiona.
Thanks, Anil.
I just wanted to ask a few questions that we generally get.
Of course.
One question is, most of the students who will be undertaking this online distance course would be working professionals.
Yes.
So what would a week of study look like
Yeah.
for a student? Example, webinars, workshops. So basically, how can they structure their study and work life, in an
Yeah.
optimal manner?
So the joy of online learning is that it's entirely flexible around your life. So all of our current students have jobs at the same time as studying. That's why the ODL Masters programme is a 3-year programme. So we don't expect you to do all of the learning for a Masters within 1 year like the on-campus courses do. So the sort of typical notional learning hours for one course is around 200 for a 20 credit course. So 200 learning hours across the full 10 weeks of the course. Now, to break that up, you're talking, it's a 10-week course, you're talking around 20 hours study per week. So that would fit in quite easily with part-time work or even with full-time work if you're able to organise your time and manage your time well. I mean, it would mean evenings and weekend study, but if that's something that you're committed to do, it's definitely achievable. And as I said, all of the learning content is available whenever you want to access it. So you can go online at any time and access the learning content, or you can download a PDF or Word document version of our learning content so that you don't need to be connected to the internet when you are accessing the learning content. You can do that flexibly. So it's entirely within your power and control as to how you want to plan out your week's studies. And we really want to maximize flexibility for you.
So I understand the course starts in September. So is there any preparation that students who are interested need to do before that? Is there a recommended reading list, for instance?
There is a reading list, but you don't have to access that until you come onto the programme. There's no need to do any prior study or reading. Each course has its own extensive reading list, and that can be accessed very easily through one click in our learning content as well. And you can just dip in and out of that. None of our reading in the courses that I'm running certainly is compulsory. It's all further. So we try and ensure that all of the essential reading from the reading list, that we have consolidated that within your learning content. And so any reading that you do from our reading list is further, and it will support your assignments, but it's not essential for you to have read everything on the reading list in order to pass this programme.
And given that most of the students who join for this program will be working professionals and who want to network, so are there any opportunities like online seminars, conferences, and so on and so forth, where they can interact with similar professionals, or who want to get on the same pathway?
Yes, we're really keen to maximise networking opportunities for our students. And in fact, this year I've put a number of our students in touch with international colleagues wherever they're based, because we really want to support the field of infant mental health and we want to mobilise the workforces within this field. And we do that by connecting you as our students with the relevant professionals in your area. So we're really keen to do that. And we're keen to maximise your opportunities to interact with each other on the course as well. So that's why we have, excuse me, our Teams page where you can interact with each other and with ourselves. And we're really keen for you to engage with all of those who have provided teaching content for us as well. So we provide the details of all of the professionals who have provided teaching content on the course, and you can connect with them if you want to discuss any of the learning content further as well.
And I'm sure quite a few students would be interested in knowing about how this MSc could be a pathway or a step towards maybe a PhD. Uh, can you offer some insight on that?
I mean, I suppose that's one of the kind of key aims with providing the training and research methodology and then offering the research dissertation as well. You know, if you are keen to pursue a PhD with the University of Glasgow, we would be really happy to connect you with professionals working in the area. So the master's programme, the original idea came from a very active infant mental health research team. And that research team has produced publications that are internationally renowned. And so the researchers, the professor who is the lead, Helen Minnis, is a really well-known infant mental health researcher. And as I said, all of those who have contributed teaching content are well known within the field as well. And so if there was an interest in pursuing a PhD, then we would happily connect you with any potential supervisors and try to support your journey to find funding for PhDs as much as we possibly could as well.
Right. What would you say are the key takeaways for the infant online program in terms of, is it more about encouraging breadth of knowledge or depth of understanding, or more from a practical perspective? What would you say the key takeaway for it is?
Yeah, so I think the key takeaway in terms of this master's program is that we're trying to produce a very holistic learning opportunity in the field of infant mental health. Because it's an online program, it is difficult to develop the practical skills that you could access from a in-person program. But we have harnessed technology. So for our year two, as I said, we've split it up in year one, theory building, year two, skills building, and year three is the application of your learning. But for year two, we're using a lot of technology, including sort of video, little film clips where you can actually work out, for example, your skills in observing infants and their caregivers. We want you to have practical experience of doing that. And so the way that we're going to do that is through film and the use of media. And so we don't see it as a barrier to developing skills. In fact, we want to develop your theoretical foundations alongside your skills so that when you graduate from this MSc, you are ready to contribute to the workforce. And that's why we've produced the interventions course as well. So we've linked in with these fantastic organisations who will give you training so that you're ready to deliver interventions in infant mental health when you graduate from this master's.
Mhm. Thank you so much, Fiona. It was a very insightful session, and I'm sure most of the students who are on this have taken away a lot of great insights. Thank you
Lovely.
so much for your
Thanks.
time.
Thank you, Anil. I appreciate the time.
Yeah. Bye bye.